Mental health issues don't go away just because there's a pandemic. In fact, some people are developing new issues that still need to be dealt with at a very challenging time. Well, there are organizations out there helping, like the Connecticut chapter of the National Alliance on Mental Illness, really getting creative with ways to try to reach people, especially young people. I'm so happy to have the executive director, Lisa Winjum, joining us now from Fairfield. Lisa, thank you so much for taking the time to join us. And please start by telling us all the different innovative things you people are doing to try to reach people who need help.
Sure, Tim. Well, thank you for having us. The first thing that we've been working on, and the most important thing for us, has been getting our support groups online. We're an organization that depends on human connection, and we want people to know that even though we are physically distancing and can't be together, that there is support available online. Our biggest program right now online is our Young Adult Connection community. This community is for people 18 to 22, and they have a daily support group. This came up right away as students started going home, leaving their campuses in Connecticut and having to go as far away home as California, and still wanting and needing their connection to their mental health supports. We've also got support groups for family members of people with mental illness, what we call our connection support groups for adults in recovery from mental illness. We have a special veteran support group, and we have a support group for people in recovery from opioid addiction, as well as family members of people in recovery for opioid addiction. So our support groups are available pretty much every day of the week. Someone can find a group that they can connect with for the support that they need. And our Young Adult Connection community has taken it a step further with doing activities. They've had a DJ dance party, a game night. They've spent a day coming up with 26 coping skills, going alphabetically from A to Z. And last week, they started releasing those coping skills on all of our Facebook platforms, starting with the most important A, ask for help.
That is amazing. Just they always say necessity is the mother of invention, and people are getting wonderfully creative. The DJ dance party, it's the only kind of thing that would work in this sort of Zoom and Skype world we're living in right now. But I've seen people be able to connect digitally that way for other reasons, and do so in a much way than I think we would have thought possible. It's more effective. How effective have you seen these new outreach efforts be so far?
The programs have been tremendously successful. Our phones are ringing all the time. We are handling an increased volume of calls. We're able to refer people into support groups. We've brought some education programs online, like our Family to Family program. We've had to do some creative problem solving with online programming. Some people live in a home with their loved one with mental illness, and they need privacy that they can't get. We have had people come on to support groups with headphones on, and although they can't speak, use the chat function. We've had young people tell us they go out to their car and sit in their car to do the group on their phone. We've had to come up with different ways to meet people where they are and let people know that wherever they aren't alone.
And you said it's both a good and a bad thing that you're seeing more and more calls, A, because you're able to help people, but B, just so many more people are needing help. So for those people who are not familiar with your organization and what you're offering, how can they best get in touch with the support skills they need, or somebody at your organization to point them in the right direction?
There's a listing of all our available support groups on our website at namict.org. Our phone lines are open. We call it our warm line, 9 a.m. to 5 p.m. Monday through Friday, and that number is 882-0236. Those calls go into staff members at their homes to handle for any information and referral you might need. There's also the National NAMI Helpline, which is open Monday through Friday from 10 a.m. to 6 p.m. at 1-800-950-6264, or you can text NAMI to 741-741. And then for those who need help, there's also the Suicide Prevention Lifeline at 800-273-8255.
Certainly a lot of information to get out there. Hopefully people have a DVR, they can go back and get it. We'll get it up on fox61.com when we can. But more options is definitely a good thing. Lisa Winjum, thank you so much for joining us.